It's my feel-good breakfast show.
Welcome back. Thank you so much for tuning in as we turn our attention to health matters and probably the most prevalent topic at the moment over the past few weeks. South African President Cyril Ramaphosa has reintroduced stricter lockdown measures in an attempt to curb the spread of Covid-19 during the second wave, as it's been dubbed, that we are currently experiencing across the country. The infection and death rate has skyrocketed during the second wave as a new variant has also been discovered here in South Africa. Medical doctor Mathobela Matjekane is here to give us an update on the coronavirus in South Africa. She might not have all the answers, but she's certainly going to try her best. Do you have a question at home related to COVID-19 in South Africa right now? We'd love to hear from you. Call us on 021 110 5552. Doc, Happy New Year.
Happy New Year to you too.
Crazy year that it is.
Very crazy start.
And again, obviously, thank you so much for joining us this morning. So I'm going to dive straight into it and ask you, especially during last night's conversation, we've all been alarmed by the numbers. So what is the latest when it comes to the numbers? And as well as the resurgence that occurred over that festive period, how did it look exactly?
Is it worse now?
It's worse. So currently we have 1.5 million people that were infected. Obviously we have about 900 and something thousand people that have already recovered from the virus, but our statistics were sitting at 1.5 million of the total ever since COVID has happened. With the second wave, since the festive has started, I think our numbers are sitting at 190,000 over a period of almost 4 weeks or so.
Wow.
Because of the whole festivities that have been happening. And also, very importantly, our mortality rate, the total number of deaths, it's now sitting at about 33,000. 4,000 of those happened in the last about 4 weeks or so during the festive season.
Wow, so more than 10% alone just in that short period. Wow.
Yes, definitely.
We know that there are many new drivers, and it's very difficult, I would imagine, to understand where it's the virus itself and the new variant of the virus that's driving this, that does seem to be operating at a much faster rate. And obviously then all of these, as you've mentioned, over the festive period, people have been gathering. There have been a number of driving factors, but of course we do see some light at the end of the tunnel. We hope in the form of a vaccine. Where do we sit in terms of South Africa? We know that our healthcare workers will be first in that queue to receive the vaccine. When are we likely to start seeing the vaccine being administered in South Africa? And how effective is it? Because there's not a huge amount of case study data to be drawn from.
Okay, basically what we need to understand is why are we vaccinating people? The first and foremost important thing is that when we vaccinate people, we reduce the amount of illness that they will have, and we also reduce the spread of the infection. So the vaccine is very important that, because we'll get to a point where we have herd immunity, whereby most of the people would have been vaccinated, and that will drop the death rate as well as the number of people that are getting infected. So like the president mentioned yesterday, the healthcare workers will be part of the phase 1. About 1.2 million healthcare workers will be vaccinated. On the second phase, it will be other essential services workers, people like your municipal workers, your teachers, people that are working in the front line, elderly people over the age of 60 will also be vaccinated. I think they're looking at about 2.25 million people to be vaccinated. And then after that will be your phase 3, whereby they will be vaccinating the rest of the population, looking more at people that are at a higher risk of getting the infection.
So I was obviously listening to the president speak last night, and he mentioned there's firstly been rumors as to where the vaccine's coming from. And then he also mentioned that there's an African Union that's been developed to kind of assist with vaccinations. Where exactly are they coming from? And at the same time, I believe our health workers need it. They're in dire need of it, and it's essential. So when exactly will they be receiving it too? I think everybody's dying to know, when are they coming? When do we get it? When does that next phase actually happen that you mentioned?
I think they're hoping to vaccinate the healthcare workers, I think, in the first month, maybe around in the coming month. And then they're hoping to have vaccinated the rest, the phases as they're facing it down within the first 6 months of the year.
Okay.
Because of the capacity and the logistics involved, you can imagine, I think about 67% of the population will need to be vaccinated. So that's quite a lot of number of people.
A few million.
Yeah.
How are we going to be able to achieve this? Are we going to be setting up vaccine centers? What do you think is the best way to deal with? Because we're going to be needing to vaccinate around 200,000 people a day to be able to achieve these sorts of numbers.
Yes, obviously there are boards and stakeholders that are involved. I'm aware that the government is talking to the private sector, pharmacies, doctors, hospitals, they're even looking at talking to religious institutions as much as they can to just try and get more people vaccinated as possible. Obviously, most of the vaccination that we have happen when we are born, which is very simple and easy to administer. But in this case, you're vaccinating a different population, which is your adult population. So you have to drive it to them and show people the importance of why you need to vaccinate them and motivate them to come in and get the vaccination.
That's going to be a battle in and of itself, you know.
So listen, now with this being said and COVID-19 coming through, there's this talk of the new variant of COVID-19. So is there much research into it? Is it something that we should be very fearful of? What is the variation of it, and how far has that research actually gone? What do we know about it?
What we know about the new variant is that it spreads very fast, but there hasn't been any evidence to say that it makes people sicker than the first one. So the most important thing about it is that it's very infectious and it spreads very fast. Hence, the advice of the president for us to be aware that we should avoid crowded spaces, closed spaces, and very close contact, because those have been shown to make the new variant to spread very, very fast. And the problem with that is that it creates a burden on the healthcare system.
Yeah.
So most of the issues that we are having is that we have, our hospitals are full to capacity.
Just don't have enough oxygen, doctors, beds.
Yes.
Let's talk about the people that aren't, because so many people have gone through this over this festive period. I've been amazed at how many people that I know close to me who have had to self-isolate, who have had coronavirus. How should we be taking care of ourselves if we do contract the virus? What medications should we be taking? Is there a particular kind of grouping of medications and vitamins that you should focus on?
Basically, coronavirus is just like a flu. It starts as a with flu-like symptoms. So your immune system is going to be lowered. So if depending on how strong your immune system is, that will determine in a way how your body will fight the virus. So in most cases, we advise patients to take vitamin C, vitamin D, zinc complex, and depending on what symptoms, because we're mainly focusing on the symptoms that you are having at that time. Most of the people, some people will suffer from shortness of breath, coughing symptoms. In those cases, then we can then start thinking of advocating antibiotics and other medication that are going to dampen your immune system so that your immune system, because what happens is that when you get the virus, your body mounts an immune response, and that creates swelling, mucus secretions, and all of that, and that can lead to a super added infection whereby you end up with people lying in ICU because they have developed complications because of the virus.
That's the weakening of the body. Doctor, thank you so much. We're going to continue this discussion. 021 110 552. If you've got any questions for the doctor, please post them right now. Let's get back into the news.